Good morning, good afternoon, good evening, wherever you guys are. My name is Mihail Borisov, and I am one of the hospitalists at Lafayette General Medical Center. Lafayette is a small town in Louisiana. You might have heard of it. It's actually the, the happiest city in America, so we try and embody that feeling as much as we can. And I was asked by one of our colleagues at the Today's Hospitalist to see if we can come up with a questionnaire to describe the perfect hospitalist candidate, or ways that we can find out more what would make a potential fit for your group, because let's face it, hospitals medicine is highly sought after these days. So finding that perfect fit is paramount to longevity within your group and ours. And our group, for example, is quite diverse. I mean, we have Indian, Eastern European, we have American. So finding that person that meshes with all personalities, and you've hit a gold mine. So in the end, it's not just about what training program you went to or how long you've been a hospitalist. It's, can you get along with your nursing colleagues? Or can you get along with the physicians, your other colleagues? Because I've had some candidates who've had an impeccable resume. I mean, conferences, research, you name it, they've had all the experiences. But I actually had the fortune of talking to the previous facility of his employment, and the nursing colleagues over there, they were fearful of him, and I'm not really sure. I think he just rubbed them off the wrong way. So if he created that tension over there, then for certain that tension would be within our institution, and that's not something that we want. So it's always important to see how that person was at the previous residence. The other thing that I look for is social aspects. I mean, let's face it, like I said, you can be the best physician, but if you cannot handle yourself in certain social situations, obviously it's not going to be a fit. And I've had some candidates, for example, where, again, impeccable resumes, but you put them in front of our hospitals group and they freeze. So they're not really good at social situations. And I understand. I mean, sometimes first impressions, the first interview, you get a little shy, but eventually your personality would show, it would shine through. And in this case, it was quite obvious that wasn't the case. So in the end, it wasn't a fit for our group. So it does matter socially what you do. Like, extracurricular activities matter, because it's not just about medicine. What you do in your social life often determines how well you perform in professional life, and vice versa. So we like our candidates to be diverse, not just medically inclined, but let's see, do you like to hike? Do you like to bike? Martial arts, sports, all of these, because life is not about medicine. It's about a lot more than that. And I myself, medicine is my professional life, but I keep it professional. Everything else on the social side, I keep it as diverse as possible. So you always have to find that balance between social and professional. And that's one of the things that we look for in candidates. Another question that the Today's Hospitalist asks is, how can a program highlight its strength? Social media is a big tool, obviously. I mean, you have your LinkedIn, you have your Facebooks, and you have your Twitters, but ultimately I still rely on the old and true word of mouth. How well you maintain yourself amongst your colleagues speaks volumes. Like, for example, we're a small town here, so you cannot basically go around creating friction, because at some point you're going to burn your bridges. So you try and do the best you can within the circumstances, and you survive, you thrive. And in this town, we've had a pretty successful hospitalist group, and I've been here for almost 4 years, and I'm as optimistic as ever. And now that I'm on the administrative side, I'm actually able to make some changes or augment things that could potentially improve the program even more. So I don't necessarily use social media that much. I mean, I do have my LinkedIn profile, but for the most part, if you want to find out about the program, you ask us personally, and we'll tell you. I think some of the other questions that they had asked is, what questions should a candidate avoid asking? And I'll give you an example of our recent opportunity for a candidate. What he asked is, will I have to see more than 8 or 9 patients? And I'm not sure what his expectation was, because, I mean, even as a resident, I saw more than that. So that itself told me that this is a physician that was not in concert with basically what reality is, because we're a busy program. I mean, we're one of the largest hospitalists in the largest hospitals in Acadia, so we cater to a large volume. So when a candidate asks me and they set a limit, will I have to see more than so and so, that itself tells me that this is not the right fit for you. We, of course, see what our standard volume as a hospitalist nationwide sees. Occasionally, we do have our upswings during the busy seasons, like now. We do the best we can. We accommodate. We try and find some extra help to kind of maintain some sanity, because in the end, it all levels out. So asking that question is a no-no. And I think one of the other questions was red flags in a physician's resume. To me, there are not really any red flags. I mean, look, you can have the most impeccable resume, you can have all these conferences, all these research papers, all this experience, but if I get to sit with you and chat one-on-one and you're not able to articulate what was written versus what I'm seeing, then I know something is wrong. To me, that's a red flag. If you can articulate your resume, then you're staying true to yourself. I, for example, am a very social person. I talk a lot, so if you can get along with me, pretty much you can get along with everyone. And so when I get a candidate, I obviously read their resume, but what I look for obviously is how well will you mesh with me and the group on a social setting, because we're trying to create a core group here for a long period of time. So I don't want a candidate that's going to come to work solely to come to work and then leave. I want a candidate that's going to come to work to basically be with us as a group, and once the work shift is over, continue life socially with us as a group. And we've done a pretty good job at that for the last 4 years here. And so, I mean, that's how we forge friendships. So it's important to have candidates that are obviously professionally and socially adaptable, because in the end, professional life does not supersede social life. So as aforementioned, I'm a big social person, so if you can mesh with us on a social aspects, you'll be able to do so on a professional level. And of course, there are all these other questions that I'm sure other potential medical directors might be able to answer, but on my end, I place a big aspect on those. So I'm hoping that's something that will set you off on the right path, and hopefully it'll help you to find the perfect job, because I know I'm at my perfect place and I can only go up from here. Y'all have a great night, and see you hopefully soon.